My name is Adrienne Manasco. I am a student nurse in the ADM program at Vernon College. I am doing this head-to-toe assessment for Sharon Cudjoe for health assessment fall 2021. This is Elise. She's going to be my model. I am going to do a head-to-toe assessment today. I'm going to be asking you a series of questions. Some may be personal. Is that okay? Good. So I have ensured privacy. I've washed my hands. I've gathered my instruments for the assessment. Everything. We're going to start with the mental status of her. She looks and appears to be all within normal limits. She's dressed accordingly to age and weather. Her posture is good. Her speech seems all intact. She's alert. Can you tell me your name?
Elise Carlson.
Okay. Can you tell me the day of the week?
Monday.
Okay. Do you know where you are?
Yes. Smallville.
Okay. And who is the President of the United States?
Joe Biden.
Okay. So she's alert and oriented ×4 of place, or name, place, time, and situation. She has good speech. She has good appearance, like I said. We're gonna move to the skin. She looks, her skin appears to be normal. No cuts, no abrasions, no bruising. Temperature is good and warm, but not hot. Assessed with the dorsal part of my hand. She has good skin turgor, which you can assess on the hand or if need be on the clavicle up here. Her hands look good, both bilaterally. Her nails look good. She has good, strong capillary refill, less than 2 seconds. She has no clubbing seen on her nails. Bony prominences look good with no abrasions, no lesions to be seen, no discoloration. She has strength. Can you squeeze? She has strength bilaterally in both of her upper extremities. And let me check your radial pulses. Okay, she has good brisk pulses, +2. Everything looks good. Okay, we're gonna move to the head and the neck. Her head looks normal, nothing abnormally sticking out to me. I'm gonna palpate your scalp, okay? I'm gonna palpate for any masses, any bumps, any lesions. I don't see any lesions, no signs of alopecia. Everything looks good, normal cephalic. So we're gonna go to, everything looks symmetric, everything looks good. We're gonna assess cranial nerve number 5, which is the facial nerve. No, cranial nerve number 7, I'm sorry, the facial nerve. So we're gonna have you smile, frown, it's hard to frown, blow out your cheeks, okay? Raise up your eyebrows and close your eyes real tight. Good deal. Her cranial nerve number 7, facial nerve is all intact, okay? Next, we are going to assess the cranial nerve number 5, which is the trigeminal nerve for both motor and sensory function. So I'm going to assess your motor function of your jaw. So I'm going to have palpate the masseter and temporal muscles and have you clench your jaw. There we go. Open your mouth. Perfect. No TMJ, no popping. So everything is intact. Cranial nerve 5, motor is intact. I'm going to do a sharp and dull test. This is going to test cranial nerve 5 sensory function. So I'm going to have you close your eyes and on your forehead, cheek, and chin, tell me if you feel sharpness or dullness, okay?
Dull. Dull. Sharp.
Okay, good. Sensory function is intact with cranial nerve 5. Perfect. So next we will move to the eyes. Yes, we'll move to the eyes. Okay, so her eyes are symmetric bilaterally. One is not bigger than the other. They're the same size. They look good. The bulbar conjunctiva is pink, light pink. No lacerations, ulcers, anything. Lacrimal apparatus. No tenderness, no sensitivity. It's not swollen. It looks normal. Sclera is white. So we will test the cranial nerve 2, sorry, the optic nerve. We did assess her vision with the Snellen chart before we started the head to toe assessment. Her vision came out to 20/20. So next I'm going to do some light reflexes to see if your pupils constrict and dilate, okay? So we're going to test for direct light reflex and indirect light reflex. I'm going to shine my pin light on both eyes. Shine it, come out, shine it, come out on both eyes, okay? Look forward. Good constriction. Good constriction. So next we will do indirect or consensual light reflex, which I will shine light in one eye and look at the other eye to see if it constricts. Okay, so we can use your hand to kind of put a shield in between. Okay, good. Okay. Indirect light reflex was all intact. We will do accommodation, which I will have her focus on an object far away. There's a curtain over here on the window you can focus on, and then I'm gonna have you focus onto this pin light when I say go, okay? So focus on the curtain. Okay, go. Okay, and her eyes dilate when she looks farther away and constricts when she looks closer to the pin light. Next, we will test convergence, which will test cranial nerve 4, the abducens nerve. So I will have my pin light here, and I'm going to come towards your nose, follow my pin light, okay? Good, convergence is intact. Cranial nerve number 4 is good and intact. So we're going to do the 6 field of gaze. That is going to assess cranial nerve 4, 3, 4, and 6. So we're going to go up and down, left and right, and to the corners. Okay, so we'll go up, down, side to side, up, down. Okay. Cranial nerves 3, 4, and 6 are all intact. Okay, so I think that's all. Then we're going to move to ears. Okay, so ears look all intact, symmetrical. They don't have any abnormalities. They look even on both sides. I'm going to palpate the tragus to see if there's any tenderness. No. Okay. No puffiness, no swollen, no signs of irritation. I'm going to look into her ear, pull back and up. No cerumen, no redness, no discharge, nothing abnormal in her ears. Next, we're going to test cranial nerve 8, the acoustic nerve, by testing her hearing ability. Okay, so I'm going to walk around, and with an arm length away, I'm going to whisper 2 words, okay, Elise? I'm going to have you hold your hand to one side of your, you can pick, whichever, right ear, left ear. We'll do right ear first, and whenever I whisper, I want you to tell me what I say, okay?
Okay. Peach.
Okay, and cover the left ear.
Apricot.
Okay, good job. Okay, so next we are going to do the Weber test. The Weber test consists of using a tuning fork. I will strike the tuning fork, put it on top of your head, and you will tell me you can hear it in both ears. or one, but you should hear it in both, okay? So I'm gonna strike it, put it on top of your head, and tell me if you can hear it, okay? Both? Good. Okay, Weber test is, I guess it would be negative. Yes, it would be negative, since she can hear it in both ears. One ear would mean she would have conductive hearing loss, and we would need further assessment for that. Next, we will assess the Rhine test. The Rhine test will test for bone conduction and air conduction. So I will strike the tuning fork, place it on your mastoid process. Tell me when you can no longer hear it. Then I will move it in front of your ear, and you can tell me when you can no longer hear it, okay? So I'll strike the tuning fork, place it on your mastoid process. I can no longer hear it, okay. I can no longer hear it. Okay, and it should be, air conduction should be 2 times longer than bone conduction. Okay, good job, Lisa. Okay. Next, we are going to go to the nose, I believe. Yes. So the nose looks midline. It looks normal, no swelling, no crookedness. Everything looks good as far as the nose goes. I'm going to palpate your senses, your sinuses, I mean. You're gonna have your maxillary sinuses, any tenderness, okay? And your frontal sinuses, no tenderness?
No.
Okay, and I'm going to have you occlude one side of your nose and blow in, or breathe in, there you go. The other side of your nose, breathe in. There you go, good deal. All patency is good. I'm going to shine my light up in your nose, okay? Assess there's no deviated septums. Nasal mucosa looks good and healthy. No discharge, no polyps. Everything looks good in the turbinates, okay? We are going to assess cranial nerve number 1, which is the olfactory nerve, which is your sense of smell, okay? So I'm gonna have you close your eyes. I'm gonna have you smell this and tell me what you smell.
Flowers.
Flowers. Okay, good. Okay, so next we will go to the mouth. The lips look good. The lips look pink. They don't look dry. They look like she's well hydrated. They have good blood circulation. Everything looks good with that exterior mouth. Let's open, show me your teeth, tongue. She has all of her teeth. They look white, clean. Tongue looks normal. No swelling, no bumps, no sores on the side of her tongue. We're gonna look up into the mouth. Hard palate looks white. Soft palate looks more pink. Say ah. Good. The uvula comes up, rises midline. Tonsils look good, no swelling. The buccal mucosa looks good and healthy. Can you lift up your tongue? Okay, good. Everything looks good. No dental caries. Okay, I'm going to assess the cranial nerve 12, which is the strength of the tongue. So whenever I put this to your tongue, if you'll push on it, we're gonna go left and right, whichever you decide first, okay? So I'm gonna press it, okay? Good job. Good strength in the tongue. Cranial nerve number 12 is all intact. When she does her uvula, when she says ah, I'm gonna let you do it again. Go ahead and say ah. We are assessing the cranial nerve 10, the vagus nerve, and then I'm going to have you swallow for me. Good, and we're going to assess cranial nerve 9 and 10 for that. I'm gonna move on to the neck. The neck is normal on both sides, bilaterally, even, symmetric, no swelling on one side or the other, no visible masses, no bruises, no lesions, the skin is all intact, skin tone is even, no discoloration. I'm going to palpate your lymph nodes, starting with the occipital lymph node, post-auricular, pre-auricular, tonsillar, submandibular, submental, the anterior cervical, which is also the cervical chain, posterior cervical, and shrug your shoulders for me, and the supraclavicular right there. And I don't feel any swelling, no masses, no tenderness. I don't feel any tenderness. Good. So everything is normal on both sides symmetrically. So next we are going to shrug your shoulders. Shrug your shoulders for me. Put it on there and feel resistance. I'm going to have you push against my hand and then push against my hand. So that's cranial nerve number 11 is spinal accessory nerve is all intact. Okay, so that I'm going to have you lay down. I'm going to have you lay down for me. I'm going to assess the jugular venous distension. If you can turn your head that way. With my pen light, I'm just going to look at her jugular, see if there's any distension. There's not. Everything looks normal, within normal limits. So while she's laying down, oh, never mind. I forgot something. So we're going to sit up. Let's sit up. So while you were sitting up, I forgot to assess your thyroid, okay? So you can do this anteriorly or posteriorly. I'm gonna do it posteriorly, is that okay? Mm-hmm. I'm gonna have to put my hands around your neck a little, okay? I'm gonna come around to the back and assess her thyroid from the posterior side. So I'm gonna have you just put your head down and turn it to the right. Good. So there's no masses, no bumps. Everything seems normal. Nothing to be alarmed or it feels good. Let's see. So next, we did the neck, did the arms. Now we'll do the thorax. We'll do the thorax. We are going to assess tactile fremitus. We are going to listen to lung sounds, and we're going to percuss on the posterior and the anterior. And so we're going to start from the posterior. Okay, so we are going to, whenever you feel my hands, I'm going to just kind of move positions. I want you to say 99. Okay.
99. 99. 99. 99.
Okay. Next, I'm going to listen. Auscultate lung sounds with my diaphragm. I'm going to have you breathe in for me. Okay, we're going to go side to side. Okay, and I'm also going to listen to it laterally. Good. Okay, good. Okay, so next we are going to check for chest expansion. We should see her chest wall come in and out, equal on both sides. So I'm going to put my hands under your ribs, and then I'm going to have you breathe in and out real big. Okay, and both hands come out even, bilaterally, good expansion. Then we're going to percuss. Can you turn just a little bit with your body? Turn just a little bit, yeah. So we're going to percuss on our middle finger with our pointer and middle finger of the other hand, and just slightly percuss. good. You should hear good resonance in the lungs. And I think that's all for the posterior chest. I'm going to come around and do the anterior. So for the anterior, we are going to 99, check for tactile frenitus and auscultate, but no percussion, okay? So, I'll just auscultate since I just, okay, so big deep breaths. Side to side. Sounds are clear and even on both sides. So I'm going to just press. You say 99. Okay.
99.
Okay.
99.
Okay.
99.
Okay. Frenitus is even on both sides. You just feel slight vibration when they say 99. So at this point, I forgot to palpate the carotid artery. So she's already here. I'm going to go ahead and palpate one at a time. So she doesn't pass out. Carotid artery, which was right here. Okay. It's brisk times or +2. Brisk +2 on both sides. Okay. So we did our thorax. Now we will. I forgot to do my chest expansion on the anterior. Sorry. Okay, so I'm gonna put my hands here. I'm gonna let you breathe in and out real big. Okay, and my hands expand when she breathes in and out symmetrically, bilaterally. Okay, now we're gonna go to the heart. I'm going to palpate the occipital pulse for 1 minute, which is what you would do for in the real world. This gives you a very accurate pulse, heart rate. So it's in midline, slightly to the left. You're gonna just go and find your apical pulse. Okay, we do that for 1 minute. Count how many beats per minute. And then we're gonna listen to the 5 traditional heart sounds with our stethoscope. And for this, we are going to use the bell and the diaphragm. For video purposes, I will just use my diaphragm, but no, I will use both the bell and the diaphragm. So, for the 5 traditional heart sounds, you have your aortic, you have your pulmonic, hold on, I think I did that wrong, aortic, no, that was right. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay. The heart sounds sound good. No murmurs, no bruits were indicated. Everything was good and clear. From here, we will check your reflexes. So I will do your upper extremities and your lower extremities. Just because we're doing reflexes, we might as well do them all together. So we're on the upper extremities. We're going to do a tricep, a bicep, and a brachioradialis. So on the tricep, we're going to hit right above the olecranon process. Okay. And then on the bicep, we're going to go right in the inside of the popliteal. Okay, and then on the brachioradialis. Okay, good deal. And we did that on both sides. Good reflexes, good and even and brisk. On the lower extremities, we are going to do the patellar reflex and the Achilles. So I'm going to lightly tap on your knee, okay, and then lightly tap onto your Achilles heel. Okay, good. Brisk on both. We did that on both sides. She's good. Brisk reflexes. Okay, so I think now we do your abdomen. Go ahead and lay down at a 45-degree angle. So we are going to inspect her abdomen. Inspecting her abdomen, it looks good, normal, no swelling, no lumps, bumps that can be seen, no ascites, no edema. We will check for peristaltic waves, abnormal waves of the stomach, and I don't see any of those. The umbilicus is midline, looks of normal range, no discoloration, no abnormal hair growth, is midline in the abdomen. And after inspection, we will auscultate. So we are going to auscultate starting in the right lower quadrant. Okay, we're gonna go right lower quadrant, right upper quadrant, and this is done with my diaphragm. Left upper quadrant, left lower quadrant. And abdomen bowel sounds are normal active in all 4 quadrants. Then we are going to percuss all 4 quadrants in the same order, clockwise. We are going to percuss the right lower quadrant, the right upper quadrant, the left upper quadrant, and the left lower quadrant. Tympani was heard over solid viscera, which is normal to be heard in the abdomen. So then we are going to lightly palpate the abdomen. We do light palpation and then deep palpation, but for this purpose, we're just going to do light. Will you tell me if you have any tenderness? We're going to palpate in the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Any tenderness? Good. She didn't have any guarding, no signs of any pain, no masses were found. Everything seemed within normal limits. Okay, so next I will listen to vascular sounds of the abdomen using my bell of my stethoscope. We will check for any breweries. We're gonna do the aortic, the iliac, femoral, the liver, and the spleen. Okay, so the aortic, the iliac, the femoral, the liver, and the spleen. Okay, all seems normal, no breweries were heard. At this point, we will move on to her legs. Her skin looks good. We'll pretend like she has shorts on. Her skin looks good. Skin tone is even. No bruises, no varicose veins, no lesions, abrasions, cuts, scrapes. Everything looks good. Skin tone is good. Skin tone is warm. Checked with the dorsal part of my hand. No edema is present on her ankles or her lower legs. She has good bony prominences here on her ankle, but no lesions, no abrasions. We will come down to her feet, check her feet. We will check her anterior tibial pulse and her doralis pedis pulse. Okay, and they are both brisk +2. Her capillary refill is less than 2 seconds on her toenails. Everything looks good. They're groomed. They're well pedicured, no signs of any fungus or anything. So can you pull against my hands? Great. Can you push against my hands? Good, good job. So strength is bilateral on both sides. She has good strength in her legs. So at this point, we will test her cerebral function and do a heel to shin test, okay, Elise? If you will put your heel to your shin and go down towards your foot, perfect. And on the other side, heel to shin towards your foot, perfect. Good job. Okay, so now I'm gonna have you, can you sit down on the side of the bed for me, please? And we are going to do the Romberg test. You wanna stand up for me? Okay, and we are going to see if you sway, okay? We're gonna put your arms out to the side, and then I'm gonna be here if you get unsteady, so safety is important. Close your eyes. Okay, she is staying perfectly still, no swaying. She does great, so that test came out negative. You can put your arms down. And then I'm gonna test your gait. Gait as far as we're gonna walk heel to toe. So we can walk towards the camera, walk heel to toe towards the camera, and then walk just normally back to me. Good, and her gait is all intact. She is very safe to be on her own. No walking devices are needed. So that is the end of my assessment. Thank you very much.